Hi, it's Mairead here from Arra Veterinary Clinic. This is Ruby. Ruby is about 16 years young. We don't mention the word old around Ruby because she doesn't think she's old yet. She's into us today for her weekly acupuncture session. So we were just going to share a little bit of Ruby's acupuncture session with you. We have her seated here on a nice heated blanket. She responds really well to acupuncture, and her owners find that she gets about 7 days out of it before she needs to come back in and visit me again. We're best buddies, aren't we? So we were going to bring you along today while we do Ruby's acupuncture. Now, going to lie down for us. Acupuncture is the insertion of a solid, really fine needle into an area to relieve pain. So this spot here is called GV14. And I tend to use it as my first spot. If a dog has been coming into me for a while, they'll be used to the first needle going in there, and they usually respond quite well. They know then what's coming next. So that's the first one in there. Ruby suffers very badly with her hips and also her tail area. She used to carry her tail sideways all the time and she wouldn't jump up. Every time I open one of these, Ruby thinks she's getting a treat. So we have been working really hard on her back area. When she first started with me, she'd only tolerate maybe about 2 needles. That was all she'd tolerate with the pain in her back. Whereas now we're getting loads of needles in. Ruby, good girl. Ruby loves food, and every time we open a wrapper, she thinks that there's a treat coming. Good girl. So we're just inserting that needle now. So sometimes we can see her muscle twitch response. So her muscles will twitch as the needle is going in. So we're just giving Ruby a lick mat to go along with her acupuncture today to keep her nice and calm. She loves food. So when Ruby first started, we probably got maybe 2 needles in, whereas now we've been working up towards 8 or 10 needles. So you see there, that's a local twitch response. So we're hitting a myofascial pain there. So when you put the needle in, she responds as if it's really painful, but then afterwards they relax into it. So again, she has a little bit of a local twitch response there. So with Ruby, we're working all around her hips and her back. She suffers quite badly with like sacroiliac pain back here. And her owners have noticed now that she's able to stand up on her back legs to get her toy. She's also holding her tail straight again. So all these are really good indicators that her body is responding really well to acupuncture. We've also started including her shoulders now as part of her acupuncture sessions because of the issues with her hips. She is carrying a lot of weight on her front area, which is leading to a little bit of pain and arthritis in that area as well. Good girl. So what we do is we insert the needles and we try to leave them in for about 10 or 15 minutes if the dog will allow it. Ruby is fasting this morning because we have to give her blood. We have to get her bloods as well. So she's very hungry. Usually we don't even need to give her a lick mat along with her acupuncture. She's actually very good. She loves it. So I'm getting closer and closer. Ruby, good girl. Good girl. Lie down. I know, good girl. That's it. That's better, isn't it? So these are all the bladder points that we're working on back here. And around her tail is the important area for Ruby. So I palpate as well just around her neck and that to find if there's any myofascial trigger points that are bothering her. And we can put a needle straight in so she feels nice and soft all the way up along there, which is all good. So she has one here. So we'll put a small needle into that to release it. So every dog responds differently, and some dogs you could stick about 100 needles into them and the owners may not even notice that it does anything for them. Some dogs you might only get as far as putting your, what we call the GV14 in, and you'll get a great response from them just by putting that needle in, stimulating the fast pain fibres. You could see a big response. Sometimes she reacts a little bit to this because it's into, so what we're doing is we're putting it straight into a trigger point now to relieve it in her shoulder. Good girl. So we'll try and give her about 10 minutes with them in. Acupuncture can be quite bonding as well with the vet. You know, you're seeing them every day or every week. They get used to it. It's a little bit different for them today. Usually they come in and there's nobody else around and they just lie down and they get their treatment and they're happy. Acupuncture is one of these things that we can add in extra along with an arthritis pain management program, because it's not adding in another drug, but you know, if your dog has arthritis, it may respond to just acupuncture, and then over time you can add in your anti-inflammatories alongside it. With the Western approach to acupuncture, you know, where you bring in your traditional kind of training as a vet as well, and you combine everything together to make it all work together. So Ruby is on anti-inflammatories, she's on joint supplements, she's also on a weight loss program and she's doing really, really well. So it's a combination of everything together that's keeping her really good. But her owner really feels that she has to get it weekly or they see a huge downfall in her. Her owners are so happy that she's now able to enjoy playing with her toys and wagging her tail, all these kind of things. So some dogs just respond really well to it. And then other dogs, you may not see a response to it. So every pet is a little bit different. You can't really call it on one session. You have to really do about 3 or 4 sessions in a row, because you wouldn't know how they're responding without giving them a few in a row. I would say it took Ruby probably the guts of maybe 2 months before we started getting a really good response with everything together. So Ruby is what I consider the best I've ever seen her, to be honest. She's doing really well at the minute, and that's a combination of pain relief, weight loss, acupuncture, and ultimately a completely dedicated owner to her needs. So it's a real team effort, and with acupuncture, I'm meeting them every week, so I very quickly learn when things aren't going so well with them. Now, Ruby, are you all done? Ruby looks for a treat now that she's all done.